Okay, imagine your body, right? It's this incredible machine, unbelievably complex, built to handle stress. It's got backups, fail-safes. It just keeps going. But what happens when those defenses, those really smart systems, start to, well, buckle under the pressure? When the body's own efforts to cope actually start to cause more problems. That's kind of a scary thought. And that's exactly where we're going today. We're diving deep into the progressive stage of shock. This isn't just about the initial hit, the injury, or whatever started it. It's about what happens next when the body's first responders are just overwhelmed. We're going to unpack this really complex chain of events, show you why this stage is such a critical turning point where the body can get caught in this dangerous feedback loop. So our mission for you today is to pull out the key stuff from the sources we've looked at. We want to show you not just what's happening, but why it turns into this downward spiral, and crucially, what it takes to step in and help. You might have a few aha moments about how intricate our bodies really are.
Yeah, that's a great way to put it, this progressive stage. It's that crucial second phase. It's exactly where the body's initial attempts, trying to keep everything running, just aren't enough anymore. We start to see the mean arterial pressure, the MAP, dip below normal. And it's not just a little dip, it's a real sign the body's losing its grip.
So how do we spot that?
Yeah.
If someone's heading into this really dangerous stage, what are the, immediate signs, the alarm bells?
You'll see some pretty clear indicators. Clinically, the patient becomes hypotensive, their blood pressure tanks, basically. Or maybe it drops significantly, say 40 points or so from the normal baseline. That's a big deal. But a really major red flag, something that tells you the brain isn't getting enough flow, is that their mental status starts to decline. You might see agitation, confusion, maybe they get really lethargic.
Right, and this is the part that feels so counterintuitive. Even if you fix the original problem, whatever caused the shock, the body's own reaction can keep the shock going.
Exactly, it's a paradox.
Like, the emergency systems are now causing the emergency. It's a vicious cycle, as you called it.
It really is. And what's kind of mind-blowing and really vital to understand is that how the body responds or fails to respond right at this stage. That's often the biggest factor in whether the patient survives. It just hammers home why catching shock early, seeing those signs, is absolutely critical. The sooner you intervene, the better the chance of breaking that cycle.
Wow. Okay. So that's the big picture, this vicious cycle idea. But let's zoom in a bit. What's actually happening inside? At the, cellular level? How do things start to break down?
Well, the heart takes a big hit. Even if it wasn't the source of the shock, initially it just gets completely overworked. The body needs more oxygen, but it can't deliver, leading to ischemia, lack of blood flow in the heart muscle itself. And then you have these biochemical mediators, think of them like alarm signals gone wild, circulating and causing myocardial depression. The heart muscle just gets weaker. It can basically just fail from exhaustion, trying to keep up with a system-wide crisis.
So it's not just the big pump failing, it's happening even smaller scale.
Yeah.
Like in the tiny blood vessels, the microcirculation.
Precisely. That's a huge part of it. The microcirculation, these tiny vessels, they lose their ability to regulate blood flow properly. Those chaotic mediators we mentioned, they trigger this. And here's where it gets really messy. Capillary permeability increases. Imagine your plumbing springing tiny leaks everywhere. Fluid starts seeping out of the blood vessels into the tissues.
Oh, wow.
Yeah, causing swelling, what we call interstitial edema. So less fluid stays in the vessels, meaning less blood gets back to the heart. And at the same time, other areas might constrict, clamping down blood flow even more, making it harder for cells to get what they need. It's a mess.
Okay, so leaky pipes, blood not getting back, and then inflammation. That sounds like it should help, but maybe it doesn't here.
It's definitely a double-edged sword. The inflammatory response kicks in, sure. It releases all sorts of mediators, some pro-inflammatory, some anti-inflammatory. But this whole process also activates the coagulation system, the clotting system. The body's trying to regain control, trying to patch things up. But sometimes this leads to, unintended consequences, like widespread, inappropriate clotting, or paradoxically, even severe bleeding. It's like trying to put out a fire by just spraying water everywhere, sometimes hitting the wrong things.
And all this leads to what you called metabolic chaos.
Yeah.
Down at the cellular level.
Exactly. When tissues and cells don't get enough oxygen, they're underperfused, they have to switch their energy production method. They go anaerobic. This is way less efficient, and it produces lactic acid as a byproduct. This acid builds up, disrupts normal cell function. It's essentially toxic to the cells.
Okay, so that's the internal chaos. How does this start showing up? How do the different organ systems react to this progressive failure?
Well, the lungs often show signs pretty early. You'll see rapid, shallow breathing. Maybe hear crackles if you listen to their chest, which means fluid. Because blood flow through the lungs decreases, oxygen levels in the blood drop, and CO2 levels climb. That lack of oxygen, plus those mediators we talked about, causes inflammation and constriction in the lungs' blood vessels too. It just makes the oxygen problem worse.
A vicious cycle within a vicious cycle, it sounds like. Can the lungs recover from that?
It gets really tough. The tiny air sacs, the alveoli, they need blood flow. Without it, they stop making surfactant, that stuff that keeps them open, so they start to collapse. And then the lung capillaries get leaky too, causing pulmonary edema fluid buildup in the lungs. Gas exchange becomes incredibly difficult. This can quickly spiral into acute lung injury, ALI, or even ARDS, acute respiratory distress syndrome. That's severe, life-threatening lung failure.
We know the heart's struggling. Does that damage stay contained in the heart muscle, or does it ripple out through the rest of the cardiovascular system?
Oh, it ripples out, definitely. That lack of blood supply, the ischemia, causes arrhythmias, irregular heart rhythms, and just general tissue damage. The heart rate can shoot up, sometimes over 150 beats per minute. That's just not sustainable. Patients might get chest pain, even have a full-blown heart attack, a myocardial infarction. We'd see markers in the blood like troponin I confirming heart muscle damage, and that myocardial depression we mentioned, plus the ventricles might dilate. It all just makes it harder and harder for the heart to pump effectively.
And the brain,
Yeah.
the control center. What happens when its blood flow starts to falter?
Yeah, that's critical. As blood flow to the brain decreases, you see the mental status decline pretty quickly. It might start subtly, maybe they seem agitated or confused. Delirium is common, that acute confusion state. But as the shock worsens, they can become increasingly lethargic and eventually lose consciousness altogether. It's a direct sign the brain isn't getting what it needs.
Okay, and the kidneys. They're filtering everything. What happens when that mean arterial pressure plummets?
Right, the kidneys need pressure to work. When the MAP drops below about 65 millimeter Hg,
Okay.
they can't filter effectively anymore. This leads straight to acute kidney injury, AKI. Basically, they start shutting down. You'll see waste products like BUN and creatinine build up in the blood. You get major fluid and electrolyte imbalances, problems with acid-base balance. And a really key sign is urinary output just tanks, drops way down, less than 30 millimils an hour, sometimes much less. It's a clear signal of acute distress.
What about the liver? It processes so much for us. How does it handle this kind of assault?
The liver struggles significantly too. Decreased blood flow means it can't do its metabolic jobs properly, so medications might not get metabolized, potentially becoming toxic. Waste products like ammonia and lactic acid build up because the liver can't clear them. And importantly, its ability to filter bacteria from the blood is compromised, so patients become much more vulnerable to infection. Clinically, you'll see liver enzymes go up, bilirubin levels rise, which can cause jaundice, that yellowing of the skin and eyes.
You know, it's interesting. The gut doesn't always get the focus in shock, but the sources really pointed to its role. What's happening there?
It's absolutely crucial and, yeah, often overlooked. When the GI tract doesn't get enough blood flow, that ischemia, again, you can get stress ulcers in the stomach, risk of bleeding goes way up. And the lining of the small intestine can actually become necrotic, die off, and slow away. That can cause bloody diarrhea. But here's the really critical part. The gut can actually drive the whole shock state further. When it's ischemic, it can become leaky, allowing bacterial toxins to escape into the bloodstream, often via the lymphatics.
Whoa.
Yeah. These toxins then circulate, causing cardiac depression, more inflammation. They just fuel the fire. It interferes with everything, cell function, nutrient metabolism. The gut becomes a source of the problem.
Okay, one last system. Blood clotting. How does shock mess with that? Does it make you clot too much or bleed too easily?
Both, actually. It's another paradox. The low pressure, the slow blood flow, the acidosis, the lack of oxygen, it all disrupts normal clotting, those inflammatory mediators we keep mentioning. They can trigger the clotting cascade inappropriately. You get tiny clots forming all over the place in the microcirculatory. This uses up all the clotting factors and platelets really fast. And this can lead to DIC, disseminated intravascular coagulation. It's a nightmare scenario where you have widespread clotting and bleeding happening at the same time.
Oh, man.
Yeah. You might see signs like bruises, ecchymosis, or tiny red spots, petechiae on the skin. Clotting times get longer because the factors are used up, so you need replacement therapy, giving back platelets and factors. The whole system is just chaotic.
Okay, so given this absolutely devastating picture, how do you even begin to turn things around? What are the key medical and nursing strategies to try and pull someone back?
Well, the specific treatments obviously depend on the type of shock, what caused it, but the overall goals are pretty consistent. Restore tissue perfusion, get oxygenated blood flowing to the tissues again. This usually involves a few key things working together. Supporting the respiratory system, definitely. Optimizing their fluid volume, usually with IV fluids. Supporting the heart's pumping action, if needed. And improving vascular tone, trying to get the blood vessels working properly again.
So those are the immediate lifesavers.
Mm-hmm.
Are there other things, longer-term supports, that are crucial in the ICU?
Oh, absolutely. Early nutritional support, ideally through the gut enteral feeding, is really important. Helps maintain the gut lining, reduces that risk of toxins leaking out we discussed. And glycemic control, blood sugar. This is interesting. We used to aim for really tight control, like normal levels, but studies showed that can actually be harmful. Yeah. So now the goal is generally to keep blood glucose less than 180 mg/dL. Using insulin carefully, monitoring closely, it's a balance. And also, using medications like antacids or H2 blockers to prevent those stress ulcers in the stomach is pretty standard practice, too. Try and prevent complications.
It sounds incredibly intensive. These patients clearly need ICU-level care. What's the specific role of the nurses here? They must be constantly active.
They are absolutely central. Patients in progressive shock need constant, minute-by-minute monitoring. Nurses are watching hemodynamic numbers, ECGs, blood gases, electrolytes, urine output, mental status, everything. Looking for those subtle changes. They're the ones giving the medications, titrating drips, managing the fluids, often making rapid adjustments based on the patient's response. And they manage the technology, ventilators, dialysis machines, maybe even more advanced cardiac support like balloon pumps. Their assessment skills and quick interventions are literally life-saving.
And a big part of that must be preventing things from getting worse, right? Especially when the patient is so vulnerable.
Exactly. Preventing complications is huge. Nurses are hypervigilant about infections, especially from IV lines or catheters, and pulmonary issues are a major focus, like preventing ventilator-associated pneumonia, VAP. There's a whole bundle of care for that. Things like regular, good oral care, using aseptic technique for suctioning, keeping the head of the bed elevated at least 30 degrees helps prevent aspiration, and doing daily sedation vacations, briefly lightening sedation to check their neurological status and see if they might be ready to come off the ventilator sooner. It's all very proactive.
You mentioned neurological status and delirium earlier. That sounds like a really big risk factor here, too.
It absolutely is. Acute delirium is incredibly common in critically ill patients, and it's not just temporary confusion. It's linked to worse outcomes. Patients who get delirious tend to need the ventilator longer, they lose more physical function, and sadly, they have higher rates of death and long-term problems like post-intensive care syndrome or PICS. That's new or worse, physical, cognitive, or mental health issues after the critical illness.
So how do nurses tackle that?
Well, first is assessment, using tools like the CAM-ICU to screen for it reliably. But prevention is key. Things like frequently reorienting the patient, managing their pain effectively, trying to promote normal sleep-wake cycles, which is tough in the ICU, encouraging early movement or mobility if possible. And really importantly, trying to minimize the use of certain sedatives like benzodiazepines, which are known to contribute to delirium. Protecting the brain is just as vital as protecting the organs.
Amidst all this high-tech care and monitoring, how do you promote basic rest and comfort? It seems almost impossible in that environment.
It's a challenge, but so important. Anything that reduces the heart's workload helps. So minimizing physical activity is obvious, but also really treating pain and anxiety effectively is crucial. A smart nursing strategy is clustering, care grouping necessary tasks together. This allows for longer periods of uninterrupted rest for the patient. And, as we just said, good sleep helps prevent delirium too. Also, protecting them from temperature extremes. If they get too cold and start shivering, that uses up a ton of oxygen and energy the body just doesn't have to spare. So keeping them comfortable actually conserves vital resources.
And then there's the family. Standing by, watching all this unfold, that must be incredibly difficult.
Oh, absolutely. Families are often terrified, confused, feeling completely powerless. Nurses play a huge role here, too, keeping families informed, explaining things in understandable terms, offering support, encouraging them to take breaks and care for themselves, which they're more likely to do if they trust the care team. Really embracing family-centered care, recognizing them as partners, is vital. It helps the patient's well-being and the family's ability to cope. It's a critical part of holistic critical care.
So we've really walked through this progressive stage, seeing how the body's own amazing responses can, under overwhelming stress, start to work against it, that vicious cycle. Understanding how all these organ systems are interconnected and how they break down, it really underscores the urgency and the sheer complexity of the care needed, and the human side of it all. It's a stark reminder of how fragile that internal balance really is.
It absolutely is, and it makes you think.